So thank you so much for joining us at this year's FORCE annual conference. My co-presenter and I are thrilled that you are viewing this presentation, in which we share practical communication tips for talking with your romantic partners about inherited cancer risk. But first, please allow us to introduce ourselves. So my name is Marleah Dean Kruzel, and I am an associate professor at the University of South Florida and a collaborator member at the Moffitt Cancer Center. My research focuses on communication of genetic risk information, and I'm deeply passionate about this and connected to it because of my own personal experiences as a BRCA2 positive previvor and a daughter of a 25-year-old breast cancer survivor. And now I'll let my co-presenter introduce herself.
Thank you. My name is Kalisi Logan, and I am a genetic counselor at the Jackson Laboratory. Prior to joining their team, I was a clinical genetic counselor at the Livestrong Cancer Institute at the University of Texas at Austin. I've always had a strong interest in hereditary cancer and even completed my master's thesis on attitudes towards dating BRCA-positive previvors.
So today we're going to be blending each of our experiences and expertise to hopefully help you feel better equipped to have what we think can be some difficult conversations with partners when you're talking about inherited cancer risk. And specifically, we're going to focus on three main areas of communication with partners. Number one, disclosing one's genetic test results. Number two, talking about risk-reducing surgeries. And number three, discussing family building. But before we begin, though, we did want to make a note that while much of the research we draw on in this presentation is about BRCA-positive women, we really believe that anyone with inherited cancer risks may have these concerns and thus can relate to our communication tips and practical advice. So to begin, let's begin with a story. We would like you to meet Andrea. Andrea is a 29-year-old who carries a mutation in the BRCA1 gene. Her romantic relationship is getting more serious, and she and her partner have started talking about that they might want to have children someday. Her partner knows that her mother is a breast cancer survivor, but he doesn't know about Andrea's inherited cancer risk. So Andrea is also considering having a risk-reducing bilateral salpingo-oophorectomy at age 35 as recommended. So as we go through our presentation, we invite you to think about Andrea's story and how she will communicate with her partner about inherited cancer risk. So why is Andrea's story important, and what can we learn from that story? Now, while it's necessary to effectively communicate with one's healthcare providers when navigating life with inherited cancer risk, it is equally important to consider and involve partners. Indeed, research suggests that communication between patients with inherited cancer risk and their partners is critical for decision-making. And furthermore, couples who share and communicate openly and effectively have decreased stress levels and may have better psychosocial well-being. So given this context, I'm going to turn it back to Kalisi, who will be discussing disclosing inherited cancer risks.
Thank you. So before I get to those communication tips, I'd like to first provide some context. Now, dating isn't easy for anyone, but it can be especially difficult for those with inherited cancer risks. Disclosing this information to a partner or potential partner is no easy feat. We know that BRCA-positive women have reported delaying, avoiding, or even being completely opposed to disclosing their inherited risk to potential partners because they feared rejection. Furthermore, there aren't many resources available on how to go about disclosing these risks. And this is why I actually chose to do a survey on potential partners on their attitudes toward dating a BRCA-positive previvor. So the results from our survey showed that the majority of participants were willing to date a BRCA previvor, which was great news. We also asked their preference on when to disclose this information. The options were 1, on the first date, 2, when the relationship became serious, and 3, after a long-term commitment, such as an engagement or marriage, was made. And we found that 80% chose that it should happen when the relationship became serious. So now that we have a general idea on when to disclose, what should be discussed? Well, we surveyed this too. We asked participants to rank the importance of information to discuss at the time of disclosure. And if you look at this slide, you'll see that there are 4 different options that they could rank from. The first being the breast and ovarian cancer risks associated with the mutation, the inheritance of BRCA mutations, number 3, cancer risk reducing options, and then number 4, the possible side effects of those cancer risk reducing surgeries. What we found is that 46 participants ranked cancer risks to be the most important information to discuss at the time of disclosure. And that's what we've highlighted here in this box. Other things, such as discussing possible side effects of the risk-reducing surgeries, were considered to be less important at the time of disclosure. All right, so let's go back to Andrea's story and think about some practical advice for her and you. Number 1, like many women who are BRCA positive, she hasn't disclosed her inherited cancer risk, and that's okay. Like what our study mentioned, it might actually be preferred by potential partners to do it at the time when the relationship is considered serious. 2, since Andrea's relationship is becoming more serious, it may be a good time to start thinking about how to go about this. A great place to start is within your own support network. Now, this can be a family member, a close friend, or even using Force's own peer navigation program. And then last but not least, at the time of disclosure, it's important to prioritize discussing what's most important, such as your cancer risk. Feel free to keep it general. You don't have to discuss exact numbers, but maybe you would just highlight things like it's an increased lifetime risk. It's not 100%. And you can also consult with a genetic counselor for a personalized risk assessment for yourself, and also to discuss different strategies about discussing risk, because that's what we as genetic counselors are trained to do. Okay. Now, while talking about risk-reducing surgeries may not be part of your first discussion with your partner, it may become more important later. So the context of discussing risk-reducing surgeries will depend on where you are in your journey. Maybe you've undergone surgery and aren't sure whether or not to tell a potential partner, or maybe you're like Andrea and have plans to undergo surgery and just need some guidance on how to discuss it with the current partner. We'll go through some of these aspects. Now, again, let's provide some context to the situation. There are a lot of emotional aspects around risk-reducing surgeries, and BRCA-positive women have reported feeling unattractive or insecure due to changes in their appearance after undergoing a surgery. They've also reported having perceptions of a limited dating pool due to feeling physically less appealing. And we see that that is clearly affecting their outlook on dating or entering a new relationship. And then we also know that BRCA-positive women who have not undergone surgery will often postpone that surgery in order to complete their families. Now, there are very few studies that explore partners' views around surgeries, but the data is positive. So current partners had reported having the same level of attraction to their partners after their risk-reducing surgery. And potential partners reported that their willingness to date a previvor was unchanged by her choice of a risk-reducing surgery. Another interesting finding from our study was that potential partners reported a desire to be involved in risk-reducing surgeries. Now, the nature of the involvement wasn't something that was surveyed in our study, but many participants did provide some examples of being involved in a supportive role. So again, let's think back to Andrea. In her case, she plans to undergo a risk-reducing bilateral salpingo oophorectomy in the future, but she also wants to have children with her partner. So if you want your partner to be involved in decision-making, engage them. Just like your close family or friends, your partner can also be part of your support network. It'll be important to negotiate their involvement using a two-way dialogue. You ask them how they'd like to be involved and also discuss how they can best support you. Number two, when discussing this information, try to avoid information overload. You might be tempted to discuss anything and everything, but you know your partner and you just want to adjust the length and depth of the conversation accordingly. Everyone has different information seeking preferences and thresholds for the amount of information that they can take in at one time. If they decide that they want more information, then you can direct them to credible resources such as FORCE or NSGC or even your own genetic counselor. Number three, just remember that making decisions about risk-reducing surgeries is an emotional process for everyone, including your partner. So it's important to acknowledge your own emotions and the emotions of your partner and include those emotions in your decision-making. All right, so we've covered discussing inherited cancer risks and risk-reducing surgeries. Now I'm going to turn it back to Marleah to discuss family building.
Thanks so much, Kalisi. So in our last section of our presentation, we wanted to really discuss communicating about family building in light of one's inherited cancer risk. So family building is just basically the act and process of decision-making about children. So this could be discussing the timing of when to have children, the number of children to have, or even the method or approach to have children. Now, family building is at its core interpersonal. And what I mean by that is that it involves two people, two individuals communicating about their needs, their desires, and their preferences in order to make decisions. Now, research has found that with couples with inherited cancer risk, they have unique challenges when it comes to making reproductive health decisions, such as guilt about passing on one's inherited gene mutation and balancing personal cancer risk management and desires for having children. As such, making a reproductive choice can be difficult and oftentimes takes a lot of time. So for example, in one research study, they found that 43% of couples reported making a reproductive choice was very difficult, and 41% reported that they needed up to a year in order to decide how and when to have children. Now, I want to point out that these couples specifically were not diagnosed with cancer, so they did have that time to make their decision. But in short, the process of communicating about family building, as this image depicts here, while it might seem like this linear process, it's actually a little bit more complicated. Couples often are having to pick their ideal scenario, but then if that doesn't happen, have some type of backup plan or plan B. So we know that couples might have difficulty in making family building decisions and that it takes some time. But what do they talk about when they're actually deciding when and how to have children? Let me tell you a little bit about a recent study with my research team that we've conducted. So we interviewed patients with inherited cancer risk and their romantic partners, and we asked them what were their main concerns when trying to build their families after they learned about their inherited cancer risk. And consistent with previous research, we found that couples were concerned about, number one, passing on their inherited gene mutation to potential biological children. Number two, being diagnosed with cancer while pregnant. Number three, beliefs and values about childbearing. Number four, substantial costs related to reproduction, such as in vitro fertilization or assisted reproductive technologies. And then last, the time pressure of undergoing risk-reducing surgeries within that recommended time frame, while also balancing their desires to be parents. Yet in addition to that, we found a few new topics which were interesting. Couples were also concerned about the impacts of child's deciding to have children on their and the impacts on their career and effects of housing in order to be able to raise those children. Also, dying of cancer was another concern. And then lastly, their emotions when making those decisions. So if communicating about family building is difficult, it takes some time, and it involves talking about a lot of different types of concerns. What can we do then to help facilitate these conversations? So again, let's think back to Andrea's story and what might be some practical advice for you and for her. In a different study that a colleague and I conducted with previvors, previvors shared specific communication strategies that they found helpful when talking about family building and inherited cancer risk, which I think is relevant and applicable to inherited cancer risk in general. So here's some of those tips that you see in this table here. The first main tip on the column on the far left is engaging in two-way dialogue, right? So thinking about communicating about family building is not a one and done conversation. It's probably going to require multiple conversations. And so you can use it as a starting point. Number two, seeking information and support needs. So seeking information from credible sources such as healthcare providers, genetic counselors in particular, for information about reproductive health and family building options that you can think about. But also keeping in mind that our family members and our friends can really provide that emotional support and help us think through these decisions. And then lastly, as you can see a theme throughout this presentation, managing emotions. So knowing that this decision making can be emotionally driven, and it's okay if you change your mind and change your mind again about your preferences and desires over time, which is why having that continued conversation in a two-way dialogue is so important. We encourage you, if it's helpful, to feel free to take a picture of this table, which is adapted from that article I mentioned, and you see that cited at the bottom. But we really hope in particular that last column on the far right might be helpful for you as you start to self-reflect about your own personal preferences and experiences. And there are also some questions too, targeting partners in particular. So to conclude, we wanted to build on our previous practical advice about leaning on your social support network. So we are now going to role play to discuss and show you how to disclose inherited cancer risk with a peer. And Kalisi is going to be portraying Andrea, and I'm going to be her peer navigator. And again, we hope that by watching us, it will kind of showcase for you how you might start to prepare to have this conversation and ultimately empower you and prepare you when disclosing to your partner.
Thanks. All right. So thank you again for chatting with me. I really appreciate it.
Of course. So what's going on?
Well, things are getting serious with my boyfriend. Just the other day, we were talking about baby names. He knows my mom is a breast cancer survivor, but that's really it. On one hand, I feel like I should tell him about my mutation because I don't want him to feel like I'm hiding something. But on the other, I'm also really nervous because I don't know how he'll react.
Wow, how exciting. I'm really glad that things are going so well with you and your boyfriend. But I can also really understand how that might be scary, given that it is going so well. You want it to stay that way, I imagine.
Yes, exactly. I really am enjoying it all, but now I have this weighing on me. How did you tell your partner about your mutation?
Well, I also waited until I felt like things were serious. So you're definitely not alone there. And I chose to tell my partner when and where I was most comfortable. So when it was just the two of us in my place and free of any distractions that we might have.
Okay, that's helpful. And at that time, what exactly did you tell him? I mean, I wouldn't know where to start.
Yeah, so I kept it pretty general. I told him that I had an increased lifetime risk to develop cancer, but that didn't mean that I was definitely going to get cancer, right? I tried to put it into perspective and said that the reason I wanted to tell him now was because it could impact our desire to have a family someday.
Okay, so kept it big picture. Is that it?
Pretty much. I didn't really want to overwhelm him at first, so I kind of left it at that. I gave him time to process, and then I told him I would be there to answer any questions when he was ready to talk about it.
All right. Well, how long do you think I should wait until I check in with him? I mean, I'm worried about our relationship changing.
Mm. You know, before we talked, I was also concerned about how disclosing this information might affect our relationship too. But honestly, I felt relieved afterward. I left the ball in his court, so to speak, right? And I think I gave him a few days.
All right. A few days. Well, I think I can do that. Thanks so much. This is really helpful. Do you have any other advice for me?
Yeah, earlier you mentioned not knowing where to start, and I found it helpful to start the conversation by trying to set the tone for the conversation we were about to have. So I think I said something like, I have something personal that I want to share with you, but this is going to be hard for me to talk about. And I think this helped him understand that it was a big deal for me to share this information with him, but also that it was important for him to listen and pay attention.
Oh, that is such a great idea. I'm definitely going to use that piece of advice because I think that's the hardest part is just knowing how to start the
Mhm.
conversation. Maybe not just bringing it up on the fly. So thank you so much for sharing. I'm really glad that you understand this and I appreciate your advice. After I talk to him, is it okay if we chat again to discuss how it went?
Absolutely happy to continue the conversation, and I'm always here to help.
Thanks so much. All right. And so that's the end of the scene. We hope that this exercise has been helpful in starting to think and prepare for this conversation. And we know there isn't a lot of information out there. And so we encourage using Force's peer navigation program under these circumstances. We also just want to say thank you and please contact us if you have any questions. Our information is here on the slide. We appreciate your time.
Thank you.
Thank you.